welcome. My name is Dr. Calliope, and I am going to be performing your neurological assessment today. How are you doing today? Okay, a little nervous. Yeah, it's gonna take a little bit of time for this test, but I assure you there is nothing that should be uncomfortable or painful at all, and if it is, you can let me know and we can stop the examination, okay? It's very low stakes. I've got an absolute wide array of things for you today, okay? All right. It's almost like we're going to be playing some games, really, at least for the start of the examination. Okay, so let's see. Would you mind just confirming your name and date of birth for me? Excellent. And is that the name you prefer to go by? Okay, and how do you like to be addressed? Excellent. So to start out with, I'm going to be asking you some questions that pertain to your neurological condition, okay? So, have you had any history of the following symptoms that I'll list off? Headaches, okay? Pain, pretty much a no-brainer, right? Weakness, like muscle weakness, okay? Poor coordination, diminished or abnormal sensations, okay, fainting, confusion, and any issues with your memory at all, short term, long term, anything like that. Okay, very good. So now we're going to get into our mental status testing, all right? So first, if you could just please tell me the current date. Okay. Very good. And where are we right now? Very good. Okay. And who is the state governor currently? Okay. Now, I'm going to have you repeat a short list of items back to me, okay? Star, square, circle, rectangle. Could you please repeat those back to me? Very good. Okay, so we're going to test a little bit of recall, okay? So I'm going to give you a list of 3 objects, and I want you to keep that in your mind. I will ask you later on in the testing what that list was, okay? We're testing your memory a little bit. Green, hat, couch. Okay, what were those items? Okay, I want you to remember those, all right? Would you mind just describing a recent event for me within the last day or two in your life? Could be what you had for breakfast yesterday, or if you went out to do some errands the day before that. Just an event that shows me that your recent memory is working. Okay. Okay. Okay, very good. Now, would you mind describing an event for me in the distant past? Perhaps if you went on a vacation as a child, or you had a school field trip, something that has occurred years ago so that we can test your distant memory, your long-term memory. Okay. Very good. And approximately what year was that, or what age were you? Okay, very good. All right. So I want to test your abstract thinking a little bit. So I'm going to have you interpret a proverb for me, okay? So if you would mind just explaining to me what you think the phrase, "a rolling stone gathers no moss," means. Okay. Okay. Okay, very good. Now I'm going to do a tiny little history test with you real quick. If you wouldn't mind just naming the last 5 presidents to the best of your memory and tell me what the state capital is. Okay. Right, and the state capital, very good. Very good. Yeah, the president question is a little tough sometimes. I don't believe I've even lived through 5 presidents, so that one can be a little tricky. All right, so if you recall, I asked you to remember a list of 3 objects a few minutes ago. What was that little list? Okay, green, hat, couch. Very good. Okay, so recall is good. So how is your mood today, and how would you consider that lately, like within the last few weeks or so? Okay. Yeah, the cloudy days so far haven't been fantastic, right? Are you excited for the holidays at all? Do you celebrate? Okay. All right. Okay. Very good. All right. So now I'm going to have you follow a simple command for me. It's going to test your ability to both follow a command and also differentiate between right and left, okay? So if you could just put your right thumb over your left ear and stick out your tongue for me. Okay? Right thumb over your left ear and stick out your tongue. Yeah, I can give you a moment. That's kind of a tricky one. You have to digest it in a second. So, right thumb, left ear, and stick out your tongue. Just like that. Yep. Very good. So now I'm going to have you name some objects for me, okay? So first, what do I have hanging on the wall back there? Yeah, painting, picture, that works, yeah. And what color can you see at the bottom, at the corner of that painting? Orange, good. And what about the little flash of color on the bottom of the other painting? Green, good. Okay, and what is this? What is this? Ball, good. And what is this? Yep, the Sharpie marker. Okay, and what about this? Okay, it's a pen. Very good. So you can identify objects easily enough. Okay, now I'm going to have you name certain body parts, okay? So what is this part right here? Nose. And what about this? Eye. And this. Ear. This. Hand. This. Finger. These. Shoulders. Okay. And what about this? Elbow. Very good. Okay, now we're gonna do a little bit of testing with a sheet right here. So what I'm gonna have you do is I want you to read each phrase. I want you to say it aloud. I'm gonna have you write it out, okay? First, this phrase. What does this say? Okay, let's move down to this one. Read it and then tell me what it says. And the last phrase, if you could just read that and say it aloud for me. Very good. And now I'm going to clip it to my clipboard, and I want you to just write what this says. I'll give you my pen. If you could just write this out for me. Very good. That is perfect. Let me just note that down. Okay. Now I'm going to have you hold out your hand for me. Okay? And then I'm going to have you close your eyes. I'm going to put an object into your hand, and I want you to just feel it in your hand and tell me what you think it is, okay? Alright, so keep your eyes closed, and I'm just going to put an object in your hand. You can take a moment to feel that object. Okay, and what is that object? Very good. It's a ball. And what about this? If I put that in your hand, what does that feel like? Okay, what is that object? Good. It's a pen or a marker. It's a little thick to be a pen, but I would take that too. And last object. Keep your eyes closed and feel the object in your hand. Play with it. See what it is. Okay, and what is that object? Very good. Rubber band or a hair tie. Especially if you feel it like that, you can feel the elasticity. Very good. Very good. Okay, so now I'm going to have you keep your hand out and keep your eyes closed, and I'm just going to trace numbers on your palm. I want you to let me know what number it is that I have traced on your hand, okay? And 8. Very good. All right, so now we're gonna have you hold out your hands again, but this time both hands, and we'll have you close your eyes. So I want you to tell me if you feel touch in one place or 2 places at the same time, okay? So for example, if I have one finger on your hand and one on your arm, that's 2 places. I have one finger on your finger, and that's 1 place, okay? So you just let me know either 1 or 2, okay? 1 or 2 places. 1. 1. 2. 1. 2. 2. 2. 2. 1. Very good. Okay. All right. We're getting closer to the end of our mental status examination, okay? So now I'm going to have you open your eyes, and I want you to copy different finger positions that I show you, okay? We're not going to be throwing up gang signs or anything like that. It'll be simple, okay? I just want you to be able to show me that you understand and can copy different commands, okay? All right, so hold up your finger like that. Okay, what about this? All right, 3. Okay, what about this? And can you steeple your fingers? Okay, can you make a square? And what about a triangle? Just like that. Okay, what about a giant circle? Can you make a giant circle? Very good. And can you splay all your fingers? Very good. Okay. All right. So I'm going to grab a piece of paper again, and I'm going to hand you my pen, and we're going to do a little drawing, okay? I want you to please draw for me a house, okay? It doesn't have to be anything special, just 2-dimensional. But I want you to go ahead and draw me a house, okay? Very good. Okay, very good. So We've even got a couple windows, a doorknob, and a sun. That looks very nice. Very artistic. Okay. Alright, so I'm gonna have you do something for me here. So I have a little box of matches here, envelope, whatever you want to call it, and I want you to take one of these matches and strike it, okay? I have a little bowl here that you can use to put it out in so that nothing catches fire. That would be a little bit awkward for our examination. Now, I don't want you to get too caught up with actually lighting it on fire. These can be a little tricky. I just want to know that you understand and can perform a simple command, okay? So I'm going to give you this, and if you just want to grab one of the matches, okay, and yeah, it just flips over like that, and strike it. Very good. Okay, I'm going to blow that out for you. Alright, and I can have that. We can put that in the bowl. There we go. So, first try. That's pretty nice. Usually takes people 2 or 3 tries, but that's really good. So now it smells a bit like a campfire in here, but I think that's probably preferable than the normal sterilized scent of hospitals. Okay. And finally, I'm going to have you do some math with me, alright? So I'm going to have you look at the math problem we have written out and tell me the answer. It's very simple, don't worry. It's quite elementary. Right. 1 plus 1. What is the answer to 1 plus 1? Okay. 2 plus 3. What is the answer to that? 4 plus 5. What is the answer to that problem? Good. 10 plus 20. What is the answer to that problem? Okay. 45 plus 5. What is the answer to that problem? Okay, and 16 plus 4. What is the answer to that math problem? Very good. Okay. Alright, so we've completed our mental status testing, okay? So now we'll move on to the next part of our neurological assessment. Okay, so now we are going to be testing all 12 of your cranial nerves, okay? So, we're going to start with nerve number 1, your olfactory nerve. So, I'm going to have you close your eyes for me, and if you could just block the right side of your nose, so only the left side is open. Okay? I'm going to open this jar, and I'm going to have you smell this scent, okay? Alright. You could just take a little smell of that. Okay, and what is that smell? Cinnamon. Very good. Okay. I'm gonna grab another one, and if you could just switch sides of your nose. Okay, and I'm just going to hold this up to your nose. What does that smell like? Good. It smells like a lemon. Very good. Okay, and we're going to take one last smell, but I'm going to have you keep both sides of your nostrils uncovered, okay? Keep your eyes closed. And if you could just smell this for me. Yep, just take a nice smell. What does that smell like? Like mint, like peppermint. Very good. Okay. So I'm just going to mark off that your olfactory nerve is intact. And now let's go ahead and move on to cranial nerve number 2, which is your optic nerve. Now I'm going to bring out our Snellen chart here, and I'm going to have you read off some letters for me. So we'll start here at the top. What is this letter? This letter. Good. And what about this line? Can you read this line for me? Good. And what about this line? Can you read this line for me? Good. And let's move down. Can you read this line for me? Good. Let's do this one backwards. Can you read this line? Good. And what about this one? Very good. Okay. And what about this one? Can you read this? Good. And let's try this one. Can you read this one backwards? Okay, and let's do this last one right here. Can you read this one? Very good. Very good. So I'm going to put our Snellen chart back. And now I want to test your visual fields, your peripheral vision, okay? So I'm going to have you cover, let's go with this eye, okay? So if you could cover that eye, and I'll do the same, all right? I want you to tell me when you see my fingers come into view and when they disappear, okay? Good. Okay. Good. Okay. Good. Okay. Good. Okay. And now if you just want to switch eyes for me, okay? Just tell me when you see my fingers and when they disappear. Good. Okay. Good. Okay. just fine. So the optic nerve looks great. So now we're going to be testing cranial nerves number 3, 4, and 6. These all govern eye movement. So you have your oculomotor, your trochlear, and your abducens. So have you had any problems with your eyelids drooping at all? Okay, I'm just going to take a little bit of a closer look here, okay? Alright, I'm not seeing any signs of ptosis, so that's good. That's good, okay? So now I'm going to have you focus your eyes on this point right here on the tip of my pen, and I'm going to have you follow it, okay? Using only your eyes without moving your head, all right? So just follow the tip of the pen. Follow the pen. Follow the pen. Follow the pen. Very good. Using only your eyes without moving your head. Okay. Very good. Just follow it as best as you can. Let's go diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. Okay, keep following this, and I'm just going to have you look up, down, up, and down. Okay, very good. You can go ahead and look wherever you'd like. All right, very good. Alright, so we're going to go ahead and test your cranial nerve number 5, which is the trigeminal nerve. So I have a cotton bud and I have a toothpick, and we're going to play a little game called soft or sharp, okay? So I'm just going to touch you with the Q-tip or the toothpick, and I want you to tell me whether it is soft or sharp, okay? So this is just to a little point. It's not going to hurt or break the skin, okay? So before I touch you, I would like to ask if that's okay with you. Do I have your consent to touch you? Okay, we've gone through the whole exam so far without it being a problem, so I just wanted to check. So I'm just going to have you close your eyes, right? And this is what the soft feels like, okay? And this is what the sharp feels like. All right? Okay. All right, keep your eyes closed. Soft. Sharp. 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 Soft. Soft. Sharp. Very good. That's excellent. You can go ahead and open your eyes. Right. And now I would just like to test your masseter and your temporalis muscle a little bit. So I'm going to have you clench your jaw, open your jaw. I'll tell you what I need you to do, but I'm just going to be touching firstly this area of your face and then this one, okay? So I'm just going to palpate your masseter muscle here. Could you clench your jaw for me? Unclench. Clench your jaw. Unclench. And open your mouth. Close your mouth. Open. Close. Good. And I'm just going to do that, but I'm going to be palpating your temporalis muscle here. You could just clench your jaw. Unclench. Clench. Unclench. Okay, and open your mouth. Close your mouth. Open your mouth. Close your mouth. Okay, very good. That all felt normal. Right? So for your facial nerve, that's cranial nerve number 7, I'm going to have you do a few different commands for me, okay? You could just open your mouth for me and show me your teeth, okay? Very good. And can you close your eyes real tight for me? Very good. Okay. Now for cranial nerve number 8, I'm going to perform one test with you now and another test for that we'll do a little later, okay? So I'm going to be testing your hearing with a tuning fork, okay? So I'm going to strike the tuning fork and I want you to let me know whether you hear it more on the right side or the left side, okay? All right. All right, close your eyes for me. Okay. Good. Mm-hmm. Perfect. Okay. Good. Mm-hmm. Very good. So for the other test, we like to test your balance for cranial nerve number 8. However, I'm going to have you walk around the room and whatnot and do some tests with that later on. So we'll test your balance when we have you already up and moving, okay? Okay. All right. So next, I want to test your glossopharyngeal nerve, okay? So I'm going to have you take a swallow for me, okay? Very good, and that also tests cranial nerve number 10. And there's my pen light. Okay, so now I'm going to have you open your mouth, and I'm going to put this big tongue depressor on your tongue, and I'm going to check your uvula with a little pen light, okay? All right, so if you could just open your mouth. Very good, and all right. Would you mind saying ah for me? Uh-huh. Very good. Okay. All right, that looks great. So that goes in the bin. Alrighty. So cranial nerve number 9 and 10 we knocked out with one fell swoop. Okay, And now to test your accessory nerve, I want you to shrug your shoulders for me. Yep, just a nice little shrug. Just like that. Okay? And now if you could stick out your tongue for me. Okay? Can you move it to one side? The other? Up? And down? Okay, you can put your tongue back in your mouth. So that completes cranial nerve number 12, the hypoglossal nerve, and that completes our cranial nerve test. So now we'll get into the motor nerves, the sensory nerves, some coordination, and a couple other things, okay? Alright, so for your motor nerves, the things that make your arms and legs go, right? That makes everything move. I just want to check around your limbs for any muscle wasting, okay? Any atrophy. Have you had any problems with any of your limbs at all? Okay, so I'm just going to just very generally look at each arm. Okay, and then at the legs here. Okay, so the muscle condition looks really good. So now I'm going to test your muscle strength. I'm going to have you perform some different exercises, different tests with me, okay? So if you could just firstly hold on to my fingers and squeeze. Okay, very good. And now I'm going to have you put your arms up like this. I'm going to push against you. I want you to resist me, all right? Okay, and now I'm going to try to pull you, and I want you to resist me. Very good. Now I'm going to move to your legs. So with your legs, I'm going to put my hands on top of your thighs. I'm going to try to push them down. I want you to push them up, okay? Very good. And now I'm just going to try to pull your lower legs towards me. I want you to resist me. Okay? And now I'm going to try to push your legs towards you. I want you to resist me. Very good. Okay. So the motor nerves look great. Now we're going to test your sensory nerves. So we are going to do the soft, sharp test on your arms, legs, hands, and feet, okay? So I'm going to have you close your eyes again, and I'm going to just show you what the soft sensation feels like on your arm. That, okay, that's soft. And then the sharp is like this. Okay, so now on either your hands or your arms, I'm going to either use the soft or sharp tool. I want you to let me know whether the sensation was soft or sharp, all right? Okay. Soft, sharp, sharp, soft, sharp, soft, soft, sharp. Very good. And now I'm going to do that with your legs and feet, okay? So on your legs here, I'm just going to show you what the soft feels like. Okay, and now the sharp. All right, so you felt those? Okay, now if you could just tell me whether you feel the sensation of soft or sharp. Soft, sharp, sharp, soft, sharp. Very good. Okay, so now I'm going to test vibration sense on your extremities, okay? So I'm going to strike the tuning fork and I want you to let me know if you can feel the vibration where I place it, okay? You don't have to have your eyes closed for this one. Just tell me if you feel the vibration. Feel that? Okay. How about that? Right? Okay. Very good. Now on your legs and feet. Feel that? Okay. About that? Feel that? Good. How about that? Okay. Very good. Alright, so now we're going to test position sense, okay? So I am going to be taking either your finger or your toe, and I'm going to move it either up or down. And I want you to let me know what position your phalange is in, okay? So if I could just take one of your fingers here. Okay, so this is up and this is down, okay? So close your eyes for me. I want you to tell me if your finger is in an up position or down. Up, down, down, up, okay? Other hand. Up, up, down, up, right? And I'm going to do that on your toes. So this toe right here, if I pull it up, this is what it feels like. And if I push it down, this is what it feels like, okay? So keep your eyes closed and just tell me what position your toes in. Okay? Up, 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 down, good. The other side, down, up, down, up. Okay, very good. All right. So now I'm going to test the reflexes in your arms and your legs. I'm going to use this reflex hammer right here. First, I'm going to test the biceps reflex. I'll have you just relax your arms in front of you, okay? All right. And I'm just going to put my hand around your elbow and one thumb on the crook of your elbow, okay? And just keep your arms relaxed. Good. And the other side. Now hold your elbow and keep one finger in the crook of your elbow. Good. And now I'm going to test your triceps reflex. So I'm just going to take your arm and I'm going to pull it up here. I want you to let me take the weight of it. Good. Just let it rest heavy. Okay. Now I'm just going to put that arm down and we're going to move the other arm up. Okay. Very good. And let that rest down. Okay, now let's go ahead and test the knee jerk reflex, okay? So just let your legs relax. Good. Any other? Very good. And I'm going to test your Achilles tendon reflex, so keep your legs relaxed. Okay. Good. And lastly, we're going to test Babinski's reflex. So I'm just going to stroke this along your sole of your foot, okay? Just keep your feet relaxed. Good. Very good. Okay. That one's a bit of an odd feeling one, I know. All right, now we're going to be moving on to the coordination part of our assessment. All right, so first, I'm going to have you touch your nose, okay? And then touch my finger here, okay? So just back and forth like this. Okay, you do that for me? Just touch your nose, touch the finger. Good. And can you do that as fast as you can? Okay? Yep, so back, forth, just like that. Okay? Very good. All right, you can go ahead and stop. Now, can you touch your finger to your nose again? Okay, and take it off. Close your eyes and touch your finger to your nose. Okay, and you can take it off. All right, so now we're going to be having you get up and do a couple of tests, okay? So we're testing your balance and your coordination here, all right? So as I said before, when we were testing your cranial nerves, one of your nerves, we wouldn't do the second test until you're already up and moving. So that's part of this, okay? So if you could get up for me, and I want you to stretch out your arms, okay, out to your sides, okay? And if you could close your eyes and start walking forward. If you happen to run in or are about to run into anything, I'll let you know, but I'll make sure that you don't fall, okay? So if you could just start walking forward. Okay, you can stop and you can open your eyes, okay? All right, if you could just finish walking to the end of the room, you can put your arms down. And then if you could come back. Good. All right. So now I'm going to have you sit down and we're just going to sit for a minute, okay? I want to test your blood pressure when you're sitting and then when you stand up, okay? All right. So while we're waiting for your blood pressure to settle down a bit, I'm just going to continue a few notes. We are almost finished with the examination. We're just testing your autonomic nervous system, which is going to be with the blood pressure, and then I'll test your blood flow real quick. Won't take too long. And then we'll be all finished, okay? Probably gotten tired of seeing this face for so long, huh? Okay, so now let's go ahead and do that test. So I have our sphygmomanometer here and my stethoscope. And do you have any preference as to which arm I put the blood pressure cuff on? Okay. So I tend to favor this side, okay? Okay, so I'm just going to inflate the cuff. Okay, now let all the air out. And I'm going to keep the cuff on your arm, and I'm going to have you stand up for me, okay? Just like that. And I'm going to measure your blood pressure again. All right, and then we'll let that out. Okay. You can go ahead and sit down. Okay, there doesn't seem to be any problem there, which is really good. So now I'm going to listen to the blood flow in your carotid arteries here, okay? So I'm just going to be putting the stethoscope on your neck, okay? So I'm going to have you take a deep breath in for me. And hold it. Okay, and exhale. And the other side, deep breath in. And hold it. And exhale. Very good. So I didn't hear any bruise in your carotid arteries, which is good. You don't have to worry about the blood flow to your brain. So that is going to conclude our neurological assessment today, all right? Do you have any questions for me? Any concerns at all? Okay, you passed with flying colors. I didn't see anything that we need to follow up about or monitor, okay? So I'm just going to sign off on this. Okay, and that will end our session today, okay? Thank you so much for coming into this clinic and having your neurological assessment with me today. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Hello there, and welcome to your cognitive screening test. My name is Dr. Calliope, and I'm going to be performing this test on you today. How are you doing today? Okay. Any particular reason why we have this test ordered for you today? Okay, just checking. All right, so our cognitive screening test measures your general cognitive function, and this has also in the past been called a mental status test. We do these tests to determine if there is a decline in cognitive function, and if so, how severe, okay? So I'll be asking you many different questions on many spectrums of topics. I'll also have you perform a few actions. I'll have you identify some things. It's a very all-encompassing test, okay? There is one part where I will need to be touching you. Is that okay with you? Do I have your permission to do that? So I'm going to sanitize my hands real quick in preparation for that. And I'll let you know when that part of the test is going to happen. It's very brief, but I do like to let you know ahead of time. There we go. Excellent. So, before we begin, do you have any questions for me? No? Okay. So, just let me know if at any point you have any questions or you need me to repeat anything. All right? Excellent. So, would you mind telling me your full legal name? Okay, and your full date of birth? Excellent. And is your legal name your preferred name? How do you like to be addressed? Okay. Excellent, thank you. Okay. Have you had any prior history of any cognitive issues? Okay. And what about any head injury? Okay. And any serious illness that could have affected your cognitive function or had any neurological difficulties at all? Okay. Excellent. So, part of our first test is the orientation to time, place, and person. So you've told me your full name, your date of birth, and I'll be asking some more questions regarding time and place. What time was your appointment at? What time were you supposed to come in to get this test? Okay. Right. And what is the date today? Okay. What day of the week is it? Okay. Very good. And what year is it? Good. Now, where are we? And what city? What county? Okay. What state? And what country are we in? Very good. Now, our next part of the test is to determine your attention and short-term learning. I want you to repeat 3 words that I say to you, okay? Right. Your words are tree, car, and house. What were those 3 words? Tree, car, and house. Very good. Okay. Now let's test your recent and long-term memory. would you mind describing an event that happened to you within the last 2 days? Could have been about a package you got, or a trip to the grocery store, maybe a park. Tell me about an event that happened within the last 2 days. I'll just be writing as you speak. Now, would you mind telling me about an event that happened in the distant past? Let's say over 4 or 5 years ago at least. Now we're going to test your concentration a little bit. I have a few different words that I want you to spell forwards and then backwards. All right? I'm not going to throw anything difficult at you, just simple words, okay? So would you mind please spelling the word place forwards? A-C-E. Very good. And backwards. E-C-A-L-P. Very good. And the word mouth, can you spell that forwards? M-O-U-T-H. Good. And backwards? Good. And could you spell the word spice for me forwards? S-P-I-C-E. Very good. And backwards for me. Good. Concentration is good. Okay. Now, for your short-term recall, I asked you to repeat a few words for me earlier. What words were those? Tree. Very good. Alright, so your short-term recall is functioning normally. Good. Now let's do a little bit of abstract thinking, okay? I'm going to ask you to describe the relationship between a group of 3 things, okay? So what is the relationship between snow, rain, and hail? What would be a relationship between those three? Snow, rain, and hail. Good. There's a few different answers for that, right? So you could have said weather. You could have said precipitation, right? Okay. Would you mind describing the relationship between daisies, roses, and sunflowers? Describe the relationship between those three items. Good. You could have said flowers or plants. And last one, describe the relationship between lemons, oranges, and apples. Yeah, could be food, but more specifically, fruits, right? Yeah. So another abstract thinking question I have for you is, I want you to interpret a proverb for me, okay? I want you to tell me what you think the proverb, a bird in the hand is worth two in the bush, for me. What do you think that saying means? What does a bird in the hand is worth two in the bush? What do you think that means to you? I'm just going to be writing your answer. Personally, I think it's a bit of a funny saying. It doesn't hold too much meaning to me, but I'm always reminded of the line that Jim Carrey has in Bruce Almighty when he's talking about bird in the hands or two in the bush. Sorry, I know this is supposed to be professional. Alright, so now I'd like to test some of your general knowledge. Now, there might be a question or two that you're a little iffy on, and don't worry too much about that. Mostly looking for the ones that are a little more easy, okay? So, who is the president of our country? And who is the governor of our state? Who is the mayor of our city? Can you name the last 5 presidents for me to the best of your ability? I know personally I've only lived through 4, so I'm a little iffy on it as well, but just to the best of your ability. Good. Very good, that's lovely. And what is the state capital? Okay. And what is the country's capital? Very good. Didn't do that bad. That's good. Now I'm going to test your language a little bit, your ability to use language. So far, you've been well-spoken and articulate. I just want to test that a little bit further. Okay. So I'm going to have you name some objects for me, okay? You don't have to get super specific, right? Just name the object, and we'll start with this. What is this object? Okay. Yep. A pencil or a mechanical pencil, right? And right at the tip here, what is this white object? Right here, what is this? This object right here. It's an eraser. Very good. And what color is our clip here? What color is the clip? What color? Yellow. Very good. Want to know a fun fact? Yellow is the hardest color for the human eye to see, while green is the easiest. May be something that's a bit obvious, but maybe I haven't thought about it before. But have you ever seen where there's yellow text on a background? You can't quite make it out. That's part of the reason. Alright, and what is this object? Usually people use them on their hair. What is this object? Good. Some people say rubber band, some say hair tie or elastic. What color is this hair tie? What color is it? Good. It's brown. And what is this object? Common household item. What is this? Good. Brand name, Q-tip. Otherwise, it's known as a cotton swab or a cotton bud. Very good. And what about this? There's a couple different answers for this one. What is this? this object? Good. So, most obvious answer would be lip balm, or some people call them chapsticks after the brand. But if you didn't know, you could say that this is a tube, plastic tube. I would have accepted that. Okay. What is this? Sometimes people bounce these on sidewalks, off walls. What is this? Good. It's a rubber ball. And what color is it? What's the primary color of this ball? Good. It's mostly purple. There is some black and silver, but primarily it's purple. Okay. And what is this? What is this object? Good. It's a rock. What color is this rock primarily? Good. I like to see what answers people have. Some people say light brown. Some people say tan. Some people get a real wild answer, beige or sienna, right? But I think just for simplicity's sake, I would call this tan. Okay? And last one, what is this object? What is this object? Generally used for cutting papers or fabric, packaging. What is this? Good. It's a pair of scissors. I would also accept shears. And what color are the blades? What color are the blades of these scissors? Good. They're silver, or I would accept gray as well, for those who are a little less colorly inclined. Good. Okay. Now I'm going to have you read, write, and repeat some phrases. Okay? So I have 3 short sentences written down on a paper. I just want you to tell me, to the best of your ability, what they say. What does this sentence say? The sky is blue today. Good. And what about this sentence? What does this one say? It is sunny outside. Very good. It's a little bit today, huh? Certainly got a lot more clouds. And this last one. There are no geese. It's a bit of a funny one. Definitely doesn't apply to around here. There are always so many geese. Now I'm going to have you write down those sentences. I'm just turning over the page. And I'm going to hand you the clipboard here. Okay? Now I'm just going to tell you what you need to write down. Alright? You can just write that down. So our first sentence was, the sky is blue today. Okay? Hold on. Right? The next one was, it is sunny outside. You can write that one down. It is sunny outside. Good. And our last one was, there are no geese. There are no geese. All done? Let's see. Okay. Very good. So, lastly, I'm going to have you repeat a few phrases, okay? I go to the school. Very good. I smell the flowers. Last one. I eat my lunch inside. What was that? Good. Very good. Okay. So we tested your ability to use language. Now we're testing your comprehension and your ability to follow simple commands. This mostly involves distinguishing
left from right, okay? I'm going to ask you to do a few simple commands, and I want you to perform that action, okay? Could you please put your left hand on your right leg? Can you do that for me? Put your left hand on your right leg. Good. For me, it'll be left hand, right leg. Okay? Now, would you mind putting your right hand on your head and turn your head to the left? Put your right hand on your head and turn your head to the left. Good. So that would be right hand, top of head, turn to the left. Just like that. Last one. Can you raise your right foot and put your left hand on your right arm? Raise your right foot and put your left hand on your right arm. That one looks a little funny, but raise right foot, left hand, right arm. Okay, good. So now we're going to do some sensory testing. And this is the only part where I'll need to be touching you, okay? So first, I'm going to have you identify objects put into your hands while your eyes are closed. You can feel the object in your hand and tell me to the best of your ability what that object is. Okay? Go ahead and close your eyes for me. Close your eyes. Good. I'm just going to place an object in your hand, okay? You can feel around. Okay. What's that object? Good. Was that pencil from earlier? Okay. Keep your eyes closed. I'm going to put an object into your hands. Okay. Just roll it around in your hands. Feel the object. And what is that object? Perfect. Was our ball. Good. Next, keep your eyes closed. I'm just going to place this into your hands. And what is that object? Okay, yep. It's our rubber band. This into your hands. What is this object? Okay, right. It's a box be able to hear the matches rolling around. And last one. Place this in your hands. And what object is that? What object did I put in your hands? Good. It's our rock. This one might be a bit tricky, but it's quite dense, very cold to the touch, and quite irregular on the surface. There aren't many manufactured objects that would look like this and have those properties. Good. So now I'm going to be drawing simple numbers on your palm. And I just want you to identify the number to the best of your ability. Okay? So if you could close your eyes and show me your palms. Okay? I'm just going to trace a number. I want you to tell me what that number is. 3, 6, 2, 9, 0, 1, 4, 8, 5. Very good. Now, last one. I want you to identify if you are being touched on one or two places. For example, on the fingers, or on the fingers and the wrist. Obviously, I can't move very far, but perhaps on the palm and on the arm. Okay? I want you to close your eyes for me and tell me whether you feel one or two touches. Okay? 1 or 2. 1 or 2. All right? One. Good. 2. 2. 2. 1. 2. 1. 1. 1. Very good. That's good. So now we're going to test your spatial relationships. First, I want you to copy my finger positions, okay? So, for example, if I do this, you copy that. Okay, how about this? this. Okay. This. 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 Good. Okay, very good. And now we're going to grab that paper again. And just going to have you draw a house for me, okay? I know it sounds simple, but you'd be surprised at some of the more simpler things that are difficult should we be having cognitive difficulties. Just draw a simple house for me. You can put a door, a couple windows. Just draw a house for me. All done? Very good. Even got a little doorknob on there. Great. So, almost finished. I'm going to have you perform an action for me. So, our matches from earlier. I want you to the best of your ability, take out one of these matches and strike it for me, okay? Don't worry too much if you can't get it lit. Sometimes these boxes don't have too much striking texture anymore. They get eroded. Okay? Just take out the match. And strike it. Maybe not, huh? There we go. Very good. I'm going to blow that out. Good. Right, you can hand that to me. Very good. We're just going to put this in the glass where it can't burn. Okay. There. Now we have a couple more tests left. First, I want you to do some math for me. All right, it's going to take a little brain power. I want you to take the number 100 and I want you to subtract the number 9 from it. So take 100, subtract 9. What do you get? 91. Very good. Now I want you to keep subtracting 9 from that result. and keep going until I tell you to stop, okay? You had 91, subtract 9, okay? Good. 82, 73, 64, 55, 46, 37. Okay, that's good. You can stop. So I know that you have that ability. Lastly, I want to ask about your judgment, okay? So if you found a wallet on the ground, what would you do with it? What would you do if you found a wallet on the ground? I'm just going to be jotting down your answer. Very good, thank you. So that's going to wrap up our cognitive screening test today. With the answers that have been given and your actions, I have no reason to believe you have any cognitive difficulties or deficiencies at all, okay? You did perfectly on this exam, and I don't believe we need to go any further with this, okay? Alright, you have any questions for me at all? Any concerns? Okay, very good. Thank you so much for having this cognitive screening test done with me today, okay? I hope you have a whale of a day and a good rest of your night. Thank you. Bye now. Hello there. Your provider will be with you in just a moment. I'm just here to grab some vitals from you, okay? Alright. Would you mind just confirming your name and date of birth for me? Okay. I'm glad I got the right person. So I'm going to start by taking your temperature, okay? I'm going to have you open your mouth for me and lift your tongue to the roof of your mouth, okay? And I'm just going to place this under your tongue. I want you to lay your tongue on top of the thermometer. There you go. You can close your mouth. Alright, we'll just hold this for a few moments. There we go. About 98.4 degrees Fahrenheit. Surprised with the heat of the day, it's not a little higher, but it's quite cozy in here today, isn't it? They finally turned on the air conditioning. It's been nice. Okay, let's go ahead and take your pulse, all right?
Do you have any preference as to which arm I take your pulse from? Okay, just come right here. I'm going to put my first two fingers along the radial artery, just at the base of your thumb. And we're going to sit here for about 15 seconds. Pulse was about 88 beats per minute. Is that normal for you? Okay. All right. So you tend to get a bit of anxiety before seeing a provider. I can understand that. I am also one of those. Even if there's absolutely nothing wrong, I still have a bit of anxiety towards it. Okay. Let me know if there's anything I can do to make you feel a little more comfortable. All right? Okay. So now we're going to be taking your blood pressure. Okay? Do you mind if I use the same arm that I took your pulse from, or does it matter to you? Okay, very good. So I'm going to grab the sphygmomanometer here. Okay. Have that ready. And I'm going to pop my stethoscope in. Very good. So let me just go ahead and wrap this cuff around your arm. Okay. And I'm just going to hold the dial here. And we're going to place the stethoscope right in the crook of your elbow there. There we go. Let me just make sure, there we go, the ball is all the way shut there. Okay, so I'm going to go ahead and fill up the cuff with air here. It's going to get quite firm, but it only lasts for a couple seconds at the most, all right? Okay. I'm just going to deflate the cuff a bit. Right about there. Okay. Let it go all the way and then check one more time. Okay. And close the valve. Very good. Okay, all the way. Excellent. I'm going to go ahead and take the cuff off your arm. And just place that to the side here. Okay. There we go. Blood pressure is definitely within normal limits. Okay, so lastly, I just want to check your oxygen saturation. I have a little clip here. If you could just hold out your finger for me. Okay, clip that on. All right, we're just going to sit here for a minute and let that get a good reading. Okay. You have anything super cool going on after this? Probably resting. Yeah, that's a good idea. I know when it gets so hot and muggy like this, it's just really nice to stay and be in a cooler environment. But I don't think it'll last too long. Just a little bit. Okay, let me check that sensor. Okay, I'm gonna take it off. Good. Okay, that looks good. So I'm gonna let the provider know that you're all ready to be seen, and I hope your examination goes well, okay? All right, thank you so much. Goodbye. Hello, and welcome. My name is Calliope, and I'm going to be performing your examination today. How are you doing today? Okay. I hope by the time you leave this examination, you feel even just the littlest bit better. Let me see here. Do you mind just confirming your name and date of birth for me? Very good. And is that your preferred name? And how do you like to be addressed? Very good. Okay. So it looks like today we are doing a cerebellar examination. Any particular reason why you wanted to have this examination done today? Okay. Very good. Okay. Are you in any current pain or have any current illness at all? Okay. Very good. Any changes to your medical history we have on file here? Okay. And what about your family history? Any changes there? Okay. And any changes to your allergies? No? Good. And what about your medication list? Very good. All right. So today we're going to be conducting a cerebellar examination. A cerebellar examination is going to involve a lot of coordination and motor testing. There is a bit of reflex testing, as well as assessing your speech. And we're going to be looking at the tone of your arms, your wrists, your legs, your knees, all around the different muscle groups, okay? So the cerebellum is Latin for little brain. Your cerebellum sits right below the cerebrum, your big brain that we usually think of, on the brain stem, right by the pons. The pons is Latin for bridge, which makes sense. So your cerebellum is right below everything, and it's divided into two halves. It primarily governs motor control and coordination, but it does have other functions as well, such as language and attention. So we are going to be assessing if there is any sign of impairment or cerebellar disease, okay? That sound okay to you? All right, I know, a lot of big words. I'll explain what I'm doing as we go along, okay? Okay,
So from this point onwards, I am going to need to be touching you for the examination. Is that okay with you? I have your permission to do that? Excellent. Thank you so much. If at any point you feel any pain or discomfort, please let me know, okay? Good. So our first test is going to be a little, well, I mean, you just sat down, but I'm going to be having you walk around the room, okay? All right, so I'm going to have you get up for me, and I'm going to have you walk to the end of the room, okay? When you get to the end of the room, I want you to turn and come back, okay? I'm going to be watching you. If I sense that you are unstable at all, I will make sure that you do not fall, okay? Very good. So if you could just walk to the other room. And turn and come back. Very good. Now, if you could go to the other end of the room, but this time we're going to do something that's known as tandem walking, which is walking heel to toe. So you'll put your foot out, and then your toe should touch your heel, heel to toe, just like that. So your feet touching as you go along, okay? I'm going to have you walk to the end of the room, heel to toe. Good. And turn and come back for me. Okay, and go ahead and stand here. So how did that feel to you? Did you feel any sort of shakiness, unsteadiness, or any of the movements stiff for you or hard to do? Okay, very good. I'm just going to have you stand there just a moment. And we're going to do a little test to rule out any sensory ataxia. Okay, so if you could put your feet together so they're touching and your arms at your side, I'm going to have you close your eyes, and I'll be here to make sure that you don't fall. You can, just try to stay as still as possible. Try to stay standing straight, okay? All right, close your eyes for me, and I'll make sure you don't fall. Just gonna stand here a few moments. Okay, very good. You can go ahead and open your eyes and sit down. So that was what is known as a Romberg's test. And with some people, their brain doesn't really understand where their body or their head is at unless their eyes are open. And should we have seen that, we would be looking at a different sort of disease than anything to do with the cerebellum. So you stood pretty straight there, didn't have any obvious waffling there. So that's good. That's good. Okay. So now I'd like to assess your speech a bit. Sometimes with cerebellar disease, we see people who speak in a slurred, staccato sort of way. So I'm going to have you repeat a few different phrases for me, and I'm going to listen to how your voice sounds and how you're able to make those words. So if you could just please say British Constitution for me. British Constitution. Good. And baby hippopotamus. Baby hippopotamus. Good. And how about careful tattletale? Careful Good. And how about separate cacophony? Separate cacophony. Good. And how about Irish wristwatch? That one's a tongue twister. Irish wristwatch. Good. Okay. Very good. Okay, so now I want to take a look at your eye movement. We're going to be looking for if there's any nystagmus or if there's any impairment in the smooth pursuit of your eye movement. I'm going to sit back a little bit. Okay, and I'm just going to have you look at my finger here. I want you to follow my finger using only your eyes without moving your head, okay? All right, so just follow my finger here. Follow my finger. Good. Good. Just watching your eyes as you follow my finger here. Follow the finger. Good, 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 good. Good. And let's try up, down. Just do the best you can. Side. Side and up, down, side, side. Good. About diagonally up, diagonally down, diagonally down, diagonally up. Good. Diagonally up, diagonally down, diagonally down, diagonally up. Very good. Okay, and go ahead and blink a few times if needed. All right. So now I want to look at if you have any problems with your saccade eye movements or your more rapid eye movements as opposed to the smooth eye tracking, okay? So I'm just going to lean over here and I'm going to place my hand right here. I want you to look at my hand, maybe where my middle finger meets my palm here, and I want you to look from this spot to this spot, back and forth, and back and forth. And I want you to do that as fast as you can, okay? So back and forth, and back and forth, and back and forth, and back and forth. Okay, you do that for me? Just move your eyes real quick, back and forth. Okay, keep going. And okay, that's good. You can take a moment before we do the other side. I know that can almost make you a little dizzy. Yeah. So I'm going to come to this side. I'm going to hold up my hand here. We'll do the same thing. You know, look at my nose. And then where my palm meets my middle finger here. And back and forth, and back and forth, and back and forth. As fast as you can. Okay? Go ahead and do that for me. Just back and forth, and back and forth, and back and forth. Just a few more moments. And there you go. I'm going to go ahead and write some notes. You just take a little break there. so no sign of any dysmetric saccades. Okay, so now we're going to do some tests on your upper limb coordination, okay? So I want to look for any dysmetria or any tremors, okay? So I am going to just hold my finger right here. That's a good distance away, almost a whole arm away from you. I want you to touch your nose and then touch my finger, okay? So it'll look something like this. Like that, okay? And I'll just be tracking my finger around, and I want you to keep touching my finger and touching your nose. Do that as fast as you can, okay? So go ahead and reach out, touch my finger, and your nose, my finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, back and forth, back and forth, back and forth, back and forth. Last one, back and forth. Okay, very good. So next, we will be looking at something known as the rebound phenomenon. So I'm going to have you hold out both your arms straight in front of you with your palms facing the floor, okay? And in a moment, I'll have you close your eyes. I'm going to be pushing down on each of your arms, and then I'm just going to release the pressure. Depending on how your arms react can give us a clue into what might be going on, if anything. Okay? Alright, so reach your arms out in front of you for me. Okay? And close your eyes. There we go. Very good. So, I'm just going to hold down one arm and release. Good. One arm and release. Good. One more time. Down. Release. Okay. Down. Release. Good. Go ahead and put your arms down and open your eyes. That was good. Your arms bounced up just a little bit before correcting, which is a normal response. Okay, so now I'm going to look at the muscle tone in your arms. So I'm going to have you just let your arm go real loose and relaxed. I'm going to hold on to it, and I'm going to be testing the range of movement on your muscles. I'll be bending your arm, rotating the wrist, moving it all around, okay? Alright, so I'm going to start with this side. So I want you to just let me take the weight of it, okay? And I'm going to move it. I want you to just let it move freely, okay? Alright, good. So I'm just going to rotate the wrist and elbow, shoulder, okay? On the wrist. Okay. Very good. Let me just do that to the other side. Let me take the weight of this arm, supporting your elbow with my hand and your hand with my other hand, okay? Just rotating the wrist and moving. Elbow here, rotating around the shoulder, would that feel to you? Any pain? Any sort of stiffness? No? Okay. Very good. So, next we're going to be checking for a phenomenon known as dysdiadochokinesia. Quite a long name, but what it means is that you would have an inability to perform fast alternating movements. So I'm going to have you do a little test where you hold out your hand, put your hand in the other hand, and flip your hand back and forth as fast as you can. Believe it or not, some people can't do that. They have cerebellar disease. So that's the whole point of checking this. Okay? So I'll have you just do that. So hold out one hand, palm up, and place the other hand palm down, and flip the top hand so your palm's facing up, and then flip it so it's facing down. Okay? So just like this. And I want you to do that as fast as you can. Just like that. Do that for me. Okay. Just keep going. Very good. You can stop. We're going to do that with the other side. So, one palm facing up, other facing down. Turn it over to face up. Turn it back. Back and forth, and back and forth, and back and forth. Okay? You do that for me as fast as you can. Good, 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 good. Keep going. All right, you can go ahead and stop. Okay. All right, so you don't have any sign of dysdiadochokinesia, which is good. And now we're going to be moving on to your lower extremities. So first, I'm going to have you lay back on the table, okay? All right, and now I'm going to be looking at the tone in your legs. I'm going to be moving your leg around, rolling around the hip, and we'll be checking the knee joint as well, okay? So just let me take the weight, and I'm just going to roll the leg around. Now some people just have more reduced tone, and some people with cerebellar disease have normal tone in their muscles. So this is just something that we double check and take into account. Okay, the other side. Just going up and around. But if we have any other signs that point to cerebellar disease, in addition to a tone issue, then we have just a little bit more evidence towards that. Okay, so now I'm going to be picking your knee up. So I'll be just putting my hand right at the back of your knee and bringing it up real quick, okay? And I just want to check the way that your leg lifts, okay? You don't have to think about it, just let your legs go floppy, okay? Let me just pick up the knee here, and I'm just going to lift that. There we go. And down. Okay? Lift and down. Good. Other side. Lift. Down. And lift and down. Very good. So most people, your heel slides back a little bit. Some people, the heel comes off the table. So I just wanted to check that that was all normal. Okay. So now I'm going to have you do another little test while you're lying down, and then I'll have you sit up. but I'm going to have you put your heel of one foot on top of your knee. Okay, can you do that for me? If you have this heel right here, you could put it on this knee. Good. And I want you to just slide your heel down until you get to the ankle. Okay, slide down, lift off, and go back to the knee. Okay, slide to the ankle, lift off, go back to the knee. Can you do that a few times for me, rather briskly? Right, knee, ankle, lift, knee, ankle, lift, knee, ankle, lift. Very good. Let's do that on the other side. I'm going to have you put your heel of this foot onto the knee of this leg, okay? And slide it down to the ankle, lift, go back to the knee, slide down to the ankle, lift, go back to the knee, okay? And keep doing that. Slide down. Yep, as fast as you can. Just keep doing that. Knee, ankle, lift, knee, ankle, lift, knee, ankle, lift. Very good. Okay. Go ahead and rest your legs. And I'll be just a moment. Very good. Okay. So lastly, I'm going to have you sit up for me. We're going to bring in the reflex hammer here. We're going to test your knee jerk reflex. All right. So I'm just going to sit back a bit and let your legs hang freely off the table. Okay? All right. So I'm just going to come in and I'm just going to do a real quick tap, tap, tap. Okay? Just like that. Ready? Tap. Good. The other side. Tap, tap, tap. Okay. Excellent. That's good. So, that will conclude our cerebellar examination. So far, I haven't seen anything that suggests that you're having any issue with your cerebellum. That's good. Do you have any questions for me at all? Can I say dysdiadochokinesia again? Yeah, it's a big word. Let me spell it out. D-Y-S-D-I-A D-O-C-H-O-K-I-N-E-S-I-A. Dysdiadochokinesia. That's a fun $10 word for you. Yeah, use that at parties. Any other questions for you? No? Okay. I'm going to go ahead and sign off then. Very good. So that will complete our cerebellar examination then. Thank you so much for coming into my office and having this examination done by me. Really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now.
Good afternoon. Thank you for coming in. Are you here to see Dr. Calliope? Okay, that's great. Please feel free to get comfortable. With your permission, would it be okay for me to just verify some of your details personally? Okay. Your first and last name? Mm-hmm. And your appointment is... You're a little bit early, that's great. Okay. Your date of birth? And it looks like you just recently had an exam for some cardiovascular testing. How do you feel about that? Anything insightful? Okay, that's good. And since that exam, have you noticed any changes in just how you're monitoring yourself and paying attention to certain characteristics of this? Okay. How have you felt for the last bit of time? Alrighty. So some of the previous notes that I have on here relating to your symptoms, have those remained the same? Have they gotten any better? Are there any other instances where you feel these were more noticeable than before? Okay. I'm sorry. Alrighty. And on a scale from 1 to 10, 1 being very relaxed, nothing bothering you, completely calm, 10 being anxious and unable to process, where would you put yourself as? And from the previous exam, how does that vary from that experience? And there's a note on here for sleeping patterns. How have you been sleeping? Yeah, I'm sorry. On average, how long would you guess your sleep is in block increments, between interruptions? How about for the last couple of days? Okay. Alrighty. Well, that pretty much sums up some of the details. I can hand off to Dr. Calliope, and she'll take extremely, extremely good care of you. Yeah, she's about as chill as you can get. Alright. If that's any words of comfort that I can offer, you're in good hands. Please help yourself to any kind of beverage, anything that would help you to relax, focus. Just be a moment, okay? Thank you very much.
Hello there. And welcome to my office. My name is Dr. Calliope. How are you doing today? Okay, yeah, a little nervous. I can understand that. I hope that by the time you leave this office, you feel even just the littlest bit better. Okay? We're going to do everything we can to ascertain what's going on, and hopefully we can get you to a more healthy lifestyle, okay? Alright, so let's see. Do you mind just confirming your name and date of birth? Excellent. Very good. And is that your preferred name, and how do you like to be addressed? Okay. Very good. Thank you. So, let me just take a moment. You saw Dr. Yvette from cardiology, right? Okay. So it looks like from all the tests that she did, there didn't seem to be anything conclusive, right? Okay. So just because she didn't find anything doesn't mean there's not anything wrong, right? When our tests don't yield any results when we first try them, that's our clue that begins a conversation rather than ending it. That tells us we have to look a little harder, right? Okay. All right. So what I can do for you today is I work with neurology. I'm a neurologist. So I'm going to test your cranial nerves. I'm going to test your motory and sensory functions. We're going to test your coordination, your autonomic nervous system, and a little bit of blood flow as well. Now, this sounds like quite a bit, but it's very easy to test these sort of things, and all you have to do is follow my instructions to the best of your ability, okay? All right, so this will help us rule out quite a bit of things, and we'll see if we can pin something better down for you by the end of this visit, okay? All right, so first we're going to start with the cranial nerve test. Now, your cranial nerves are, of course, a bunch of nerves in your cranium, right, your skull, and these nerves govern things like your sense of smell or your swallowing. Some of them have functions with your heart rate, your ability to shrug your shoulders. There's quite a few different functions of all of these nerves, and I'll be testing them to make sure that they're intact and that nothing is going on with them. If one of your cranial nerves isn't functioning right, then we can discuss treatment afterwards, but some of them, it can be quite easy. For example, if your trigeminal nerve is a little pinched, which we see with people that have a lot of muscle tension around their neck and their occipital area, if they get that impingement, you might feel tingling or numbness on the side of your face, but with a little bit of physical therapy and relieving that tension, we can see those symptoms go away. So it might be very easy, okay? So I don't want you to be worried if we find anything, okay? All right, so we're going to start with your olfactory nerve. That's your first cranial nerve, and it governs your sense of smell. Now, from this point onwards, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Excellent. Thank you so much. So I'm going to have you close your eyes for me, okay? And I'm going to have you smell something, okay? So I'm just going to hold this under your nose, and I want you to tell me what you think it smells like, okay? Just going to just wave this under your nose. And what does that smell like to you? Okay, kind of menthol-y? Yeah, so that is a eucalyptus mint kind of smell. So menthol would be correct. So your sense of smell looks to be intact. You haven't had any problems with it in the past, have you? No. Okay, very good. So we're going to test your cranial nerve number 2, which is your optic nerve. Your optic nerve governs your sense of vision.
So, have you had any problems with your vision as of late? Okay, no. And I'll double check in your chart, but have you had an eye examination recently? Okay, quite recently. That's good. And they didn't find anything wrong there. Okay, so then for our optic nerve, we're just going to test your peripheral fields, okay? So I am going to have you put your hand over one eye for me, okay? Yep, and I will mirror that same eye, so we both have this eye covered. I'm going to bring my fingers in, and I want you to just tell me when you see them come into view, okay? I'm going to test the 4 quadrants of your vision. Okay? So you just let me know when you see my fingers come into view. Okay? Good. 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 Okay. We're going to switch sides real quick. So go ahead and cover this side, and I'll cover this side. Good. 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 Excellent. Okay, so your peripheral fields look pretty great with that test. We're going to do another test, and I'm just going to have you look straight at my nose, okay? I want you to keep your eyes focused on my nose, and I'm just going to be wiggling my fingers at one side or the other. I want you to just tell me which side you see wiggling, left or right, okay? Yeah, real simple. So just look at my nose, and I want you to tell me when you see the fingers wiggle, okay? Good. 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 Excellent. Okay. So that looks great. I'm just going to take a note real quick. Okay. So for our next tests, we're going to be testing cranial nerves number 3, 4, and 6. These are your oculomotor, your trochlear, and your abducens nerves. These govern your eye movement mostly, okay? So real quick, I just want to have a good look at your eyes. I'm going to get a little close for this, okay? So I just want to make sure that there isn't any sign of drooping in the eyes, which might indicate a problem with our cranial nerves 3, 4, and 6. And your eyes look good up close. While I've been watching you from afar, I haven't seen any signs of any ptosis, so that's good. Now, to test your eye movement, we do a test called Follow the Light. Now for this, I'm going to use a pen light here, and I'm just going to have you track the movement of the pen light using only your eyes without moving your head, okay? So I'm just going to have you focus right here. Make sure to use only your eyes without moving your head, okay? I want you to follow this light. Good, just like that. Just follow the light to the best of your ability. That's wonderful. Just keep tracking the light. I know sometimes it goes a little in and out, but just do the best you can. Good. Okay, let's go up, down, side, the side. Good. Up, down, the side, side. Okay. How about diagonally up, diagonally down, diagonally down, diagonally up. Good. Diagonally up, diagonally down, diagonally down, diagonally up. Very good. Okay, so your eye movement looks great. I didn't see any delay in any of your movement. There wasn't any skipping. Okay. Okay, so next we test cranial nerve number 5, and this is your trigeminal nerve. So we're going to be doing a couple tests like this, but we're going to start with your face. We're going to do something known as the soft, sharp sensation test. I have a cotton bud and I have a toothpick. And I'm just going to be pressing these along your face, and I just want you to tell me whether you feel the soft or sharp sensation. Okay? I'm just going to test these real quick along your jaw so that you can see what they feel like. Okay? Start with the soft. Okay? And then we're going to do the sharp, which is just a little poke, not even a prick necessarily. It's definitely not enough to hurt, okay? Just gives you a sharp point of sensation. Just going to poke, 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 poke. Okay, you feel that? Excellent. So I'm gonna have you close your eyes for me. Okay? And I just want you to tell me whether you feel the soft or sharp sensation. Okay? Good. Close your eyes. Keep them closed. Okay? Soft. Sharp. Soft. Soft, sharp, soft, sharp, sharp, soft, 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 sharp. Very good. I'll put those away for now. And now I'm just going to feel along your masseter
and your temporalis muscles in your face, okay? So when I ask you to, I'm going to have you clench your jaw for me, okay? Just want to check around, feel for any wasting or any problems with the muscle tone, okay? So I'm just going to have you clench your jaw for me. Good. Release. Clench. Release. Clench. Release. Good. I'm going to feel around your temporalis. Okay. Clench. Good. And release. Clench. Release. Clench your jaw. And release. Very good. Okay. That felt good. And take just a moment. Okay. So I'm going to have you follow my instructions for just a moment, okay? We're going to test your facial nerve, which governs a lot of your facial movement, okay? So first, I'd like you to open your mouth real wide for me, okay? Good, and close your mouth. And if you could smile real big for me. Yep, show your teeth. Good, and if you could frown for me. Good, and puff out your cheeks. Excellent. And if you could close your eyes real tight for me. Very good. Go ahead and keep them closed for just a moment. I'm going to try to open them. I want you to resist me. Keep them closed, keep them closed, keep them closed. Good. Okay, you can go ahead and open them. All right, that looks great. Okay, so for your acoustic nerve, there is a couple of things we can do, but one of them we are going to be testing a little later on, so we're just going to focus on one test for now. So to test your acoustic nerve, we're going to stick with a little hearing test, okay? So I'm going to be using a tuning fork for this test. This is a C note. It is a 512 hertz tuning fork, okay? So I'm going to be striking the tuning fork, and I'm just going to have you tell me whether you hear it in your left ear or your right ear, okay? All right, so I'm going to have you close your eyes for me. That way you can't see what side I'm on, right? Good. Mm-hmm. Good. Good. Mm-hmm. Okay, very good. So your hearing is intact. You haven't had any problems with that lately, have you? No. Okay. Have you had a hearing test lately? Oh, I see. So you've had one very recently as well. Excellent. Okay. And they noted down that there isn't any hearing loss. Very good. Okay. So then for your balance test, we'll do that a little later on. And that further tests your acoustic nerve. So now we're going to look at the glossopharyngeal nerve. So we're going to do a little swallow test. This also tests one of your other cranial nerves as well.
but I have a little bit of water here, okay? Straight from the tap. And I want you to take a sip of this water, hold it in your mouth, and when I tell you to, go ahead and swallow, okay? So here's this for you. You can take that when you're ready. Good. Take a sip. Hold it in your mouth. And swallow. Okay, good. Was there any issue with that? Any problem in doing that? No? Okay. Very good. Let me just note that down real quick. So that also helps test your vagus nerve, which is cranial nerve number 10. And now we're going to be taking a look at your uvula in the back of your throat, okay? So I want you to just open your mouth for me, okay? Very good. And let me see. Okay, here we go. We're just going to hold your tongue down here, okay? Very good. And if you could say ah for me. Very good. Okay, you can go ahead and close your mouth. All right, so glossopharyngeal nerve looks great. Now, for the last two nerves, we just have a couple of simple tests, okay? So for your accessory nerve, all I'm gonna have you do is shrug your shoulders, okay? Pretty easy, a little hard to fail. So if you could just shrug your shoulders for me. Good. Now, I want you to bring your shoulders up, and I'm going to try to push them down, and I want you to resist me, okay? Okay, resist me pushing down. Good. And now I'm going to push down on your shoulders at rest, and I want you to press them up against my resistance, okay? All right, go ahead and lift your shoulders up. Okay, good. You have good strength in that. Now finally, for our last cranial nerve, number 12, we have the hypoglossal, and this governs your tongue movement. So we're going to have you stick out your tongue, okay? Yep. And we're going to do a little movement test. So if you could move your tongue up, and down. Good. Side. And the other side. Okay. Can you open your mouth for me and lift your tongue to the roof of your mouth? Very good. Just going to take a little peek while I'm here. Okay, great. So you can go ahead and let your tongue rest back down. All right. Good. So that concludes our cranial nerve exam part of our assessment today. Now, I'm going to be looking at signs that your motor nerves are having some issues. So for this, I first want to check for any muscle wasting. I want to just feel around the muscle tone in your extremities, okay? And then we're going to be doing some resistance tests to test the strength of your muscles, okay? Good. So I'm going to feel around your arms, your hands, your legs, your feet, okay? All right, don't need to do anything, just relax here.
It's rather warm in the office today, isn't it? I know. Heat waves, huh? It came a little late for us, though. As much as I do detest being uncomfortable, I much rather detest being cold when it's supposed to be hot. So, I don't mind. I mean, the AC constantly runs, but that's okay. Okay, so while I'm here with your upper extremities, we're just going to do those resistance tests, okay? So first, I'm going to have you put your arms up like this, okay? So your arm is at a 90-degree angle. You're holding them up against me, okay? And I'm going to try to push your arms forward. I want you to resist me, okay? Good. And now I'm going to try to pull you towards me. I want you to resist me. Very good. Okay. So you can go ahead and relax your arms real quick. So I'm going to have you splay your fingers for me like this. I'm going to try to push them together. And I want you to resist me. Very good. And if you could hold your fingers together, I'm going to try to pull them apart, okay? And I want you to resist me. Good. Good. Okay. So now I'm going to have you hold your hands up. I'm going to try to push your thumb down. I want you to resist me, okay? Good. Good. And now I'm going to try to pull your thumb up, and I want you to resist me. Good. Excellent. Okay. So now I'm going to move on to your lower extremities. So I'm just going to feel around your legs. And a little bit into your feet as well. Okay. Tone looks good. So now for our strength tests, I'm going to put my hands on top of your knees and I'm going to push down. And I want you to try to push your legs upwards, okay? So I'm going to try to push down. I want you to push up. Good, okay. Now I'm going to hook my hands underneath your legs here, and I'm going to try to pull up on your legs. I want you to push back down and resist me. Okay? All right, I'm going to try to pull up. I want you to push down. Good. And now with your shins, I'm going to try to push them forward, okay? I want you to resist me. Good. And now I'm going to try to pull them towards me, and I want you to resist me. Good. And now with your feet, I'm going to have you just have them out. I'm going to try to push down. I want you to resist me. Good. And now I'm going to try to bring them up from the bottom. I want you to resist me. Good. And now I'm going to try to pull your big toe upwards. I want you to resist me. This one can be a little tricky. Good. And if you could just point your toe up, I'm going to try to push it back down, and I want you to resist me. Okay, very good. So that looks good. Okay, so now we test your sensory nerves.
So we're going to start with that soft, sharp sensation test that we did earlier on your face. And I'm going to have the toothpick and the cotton bud. And I'm just going to be touching along the arm. And you can tell me soft or sharp, okay? I want you to close your eyes for me. That way you can't cheat. All right. And I'm just going to either do the soft or sharp sensation on your arms. Okay? Soft. Sharp. Soft. Soft. Sharp. Soft. Good. I'll switch to the other arm. Soft. Soft. Sharp. 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 Soft. Very good. Okay. I'm going to do that on your legs and feet. Okay. I'll start with one leg and then move to the other. Soft. Soft. Sharp. Soft. Sharp. Soft. Okay, and the other. Soft. Sharp. Sharp. Soft. Soft. Sharp. Good. Now the next one, we're going to test your vibration sense. So I'm just going to be striking a tuning fork, and in addition to making sound, of course, sound is just vibrations. You may not be able to hear this one well, but this gives great vibration. So I'm just going to be placing it on your skin, and I want you to just tell me if you feel the vibration, okay? All right, so I'm just gonna have you close your eyes again for me. You just let me know when you feel any vibration. Good. 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 Yep. Very good. And now I'm going to test on your legs. Good. 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 Very good. I know it's a little bit of a strange sensation. Okay, so now we're going to test your position sense. So I'm just going to move your finger either up or down, and I just want you to tell me whether it feels like it's up or down, okay? That's all you have to do. So if you could just put your hands out in front of me. Good. We'll start with one side. So this is up, and this is down. All right. So if you could just close your eyes for me. Okay. And I'll just move this up, up, down, up, down, down. Good. The other side. Down, up, up, down, down, up. Very good. I'm going to do that with your toes real quick. Okay. So this is up and this is down. Okay. Good. So you just let me know what position your toes are in. Up, 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 down, up, down, down. Good. Up, down, up, down, down, up. Very good. So position sense looks great. Let's go ahead and test your reflexes real quick. Okay. So I'm going to start from the bottom of your body and work up. Okay. So we're going to start with your Achilles tendon. I just want you to let your legs hang freely for me. Okay? I'm just going to come around to the back of your foot and just tap, tap. Good. And tap, tap. Excellent. So we're going to do the knee jerk. Tap, tap. Very good. Tap. That was a little better. There we go. Okay. And now we're going to test the biceps reflex. I'm going to put my thumb right in the crook of your elbow, and I'm just going to be tapping on my thumb. Okay. Just let your arm relax for me. Good. Good. The other side. Okay. Good. Good. And your triceps. So I'm just going to lift your arm up. I want you to let me take the weight of it. Okay. Good. The other arm. Let it relax. There you go. Reflexes look great. Okay, we've got a few more tests to do. All right, I promise it's almost over. So we're gonna do a little coordination test. I'm gonna be holding my finger out in front of you. I want you to touch your nose and then my finger. Okay, just like this. And I might move the finger around. I want you to continue to try to touch my finger, okay? So I'm just going to put my finger up. I want you to touch your nose and then my finger, okay? Back and forth as fast as you can, right? Touch your nose, touch my finger, nose, 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 finger. Very good. Okay. So you just note that down real quick. And now I'm going to have you, with eyes open, touch your own nose, okay? And then put your hand back down. Good. And now close your eyes, touch your nose, put your hand back down. Very good. Okay. So now we're going to do a little bit of balance testing as well. I want you to stand up for me, okay? And if you could have your arms straight out, all right? I want you to close your eyes and walk forward for me, okay? I'll make sure you won't fall. Just close your eyes, arms outstretched, and walk forward a few steps, okay? Okay, good. You can go ahead and stop and open your eyes. All right. So last test, we're going to test your blood flow a little bit. I want you to just go ahead and sit down for me. First, I want to take a little listen for any bruits in your carotid. So a bruit is an audible heart murmur. And I'm just going to auscultate one side at a time, okay? So I want you to take a deep breath in for me and hold it. Good, and exhale. Good, and one more time. Take a deep breath in for me. Good, and exhale. So let's talk a little bit about our findings, all right? So to be honest, on the neurological side, I didn't find any problems, which is both a good thing and a bad thing, right? Because at least if we found something, then we had something to point to, somewhere to investigate further. But it's also a good thing because obviously you don't have any problems neurologically, but also I think I have a better idea about what's going on, okay? So what I think is going on based on your symptom list and everything that I've observed with you, I think you are having what's known as panic attacks. You've probably heard of them. They're quite common, actually, and many people with generalized anxiety, PTSD, OCD have them, and even people that don't have an anxiety disorder can get panic attacks as well. Now, the problem with panic attacks is that they mimic so many problems, right? And it's basically your body's warning system is going off, right? You have your fight, flight, freeze kind of system, and your body is just pushing all red lights. Now, what's even more tricky with panic attacks is oftentimes you don't understand why it's happening, especially if you are, say, driving or you're out with friends or you're just minding your own business and all of a sudden you start getting all these awful symptoms that don't make any sense, right? So then we also can call them silent panic attacks, right? There's a lot of things that are going on. We don't understand why, but they're still happening nonetheless, right? Now, the way we can identify these is by looking at our symptoms. I'm going to read you a list of symptoms we see in panic attacks, and it wouldn't surprise me if quite a few hit home for you. So you can get palpitations, pounding heart, or an accelerated heart rate, sweating, shaking, the sensation of shortness of breath or a smothering feeling. We have a choking sensation, chest pain or discomfort, nausea or abdominal stress, feeling dizzy, unsteady, lightheaded, or faint, chills or even heat sensations, numbness or tingling sensation, derealization or depersonalization, which is basically like you don't feel real, you don't feel like a person, almost like disassociating, fear of losing control or going crazy, and fear of dying are the main symptoms to watch out for. Now, any of these symptoms on their own are scary, and they would lead you to believe that something's going on. And I think you are right in coming to me and Dr. Yvette to try to figure out what's going on. But I think that we're dealing with panic attacks. And on the one hand, while that sucks, it sucks a lot. On the other hand, they don't have any long-term health consequences, especially if we can get them tamped down a bit. And there's a multitude of ways to treat them. We can do lifestyle changes, we can go the medication route, we can try therapy. There's quite a few different avenues that we can take, okay? So the good thing about panic attacks is that they don't generally last very long. So typically they last between 5 to 20 minutes. And generally at 10 minutes is the peak time. That's the time where you feel the worst. Now, almost all of them subside within an hour. You can get recurrent panic attacks when you start recovering from one and just go straight into another. That is possible. But again, if it's a one isolated incident, at most it'll take up to an hour, okay? So a few different ways that we can treat this right now is we can do progressive muscle relaxation. So there's tons of videos and resources out there, but when we have panic attacks, we oftentimes will tense up our entire body. This will make all those sensations feel even worse, okay? You'll feel really sore after. You'll probably feel pretty exhausted, yeah? So to do some progressive muscle relaxation when we're in the throes of a panic attack, it'll help keep us a little looser. It may help the panic attack itself, but it'll definitely help that muscle tension, okay? Another thing we can do is taking time alone, either by ourselves, or you could also have someone you trust, someone who can help guide you through a panic attack for a little bit in a quiet area, an empty room, even against a wall. You want to reduce the stimulus, okay? Because more noises, more sights, things like that can throw you even deeper and make it go even longer, okay? We can also do breathing exercises, including, we've seen in movies where people breathe through the paper bag kind of deal. Well, there's a reason they do that, and the paper bag deal is because you're breathing in that recycled air, and that extra carbon dioxide that you're breathing in will increase in the blood, and it'll calm you down a little bit more. Otherwise, you can do some deep breathing. Now, sometimes this makes panic attacks feel worse. So if you start feeling worse after trying to do a little bit, go ahead and stop, okay? You don't want to make yourself feel worse. But a lot of times when we're hyperventilating, we feel short of breath, then breathing in deeply reminds us that we still have the ability to breathe. It helps guide us through, okay? We can also do some distancing and distracting. These are two skills used oftentimes in DBT therapy, and we use this when someone with emotional intensity is experiencing a 4 or a 5 out of 5, and what you're doing is you're removing yourself from the situation. Either go to a different room, leave your house, go back to your house, just change your environment and do something distracting. Whether that's playing a video game, tidying up if you want, drawing, something you like to do, okay? And we do that until that intensity comes down, all right? And lastly, we could talk about doing therapy as well, which is helpful for many people. And you don't have to do that right now, but that might be able to help find the cause of your panic triggers, and it can give you a lot more tools in your toolbox to try to address them. Now, with panic attacks, you may find one method is more successful than another. And then the next time you have one, you may notice that that method doesn't work anymore, but another one does. What we want is a multitude of options so that if something doesn't work, you switch to something else. And then hopefully one of those will help you out. And even if you've gone through all the tools in your toolbox and nothing's worked, more than likely by that time, the panic attack will be subsiding anyway. Okay? So even doing something like walking, going on a walk, that exercise can help calm your body down, that helps distract you, that helps distance you from either the area that's triggering you or just getting you away in general, getting you to a new environment. All right? So this is a lot of information, so I'll be sending this home with you, okay? I don't want you to feel like it's stupid or like it's just simple and you should be able to get through it, because it is scary. And your body's just trying to keep you safe. And it doesn't really know exactly how. It's an evolutionary thing that didn't quite catch up to the times, right? So your body thinks that you're in danger, and in the past, that's what you did, is you panicked. You ran from whatever was dangerous. Nowadays, there's not a whole lot that's immediately dangerous. So your body's just trying to protect you. Unfortunately, it just doesn't know how. Not in a constructive way, at least. Okay? So that's how we learn these different things to basically be like, okay, I understand, you're just trying to protect me, but this isn't very productive for me. So it takes a little bit of time and a little bit of work, but it is possible to reduce the frequency, and you can see remission as well. Okay? So I'll send this all home with you. And if you have any more problems with this, go ahead and let us know. Okay? We may need to do something like medication to help get them under control, get you back to an even keel. And then when you feel a little bit better on your own, you might be able to retry some of these different things and revisit them. Okay? This doesn't have to be forever. Okay? All right. Any other questions for me at all? Okay. If you do have any questions, just let me know. If you want me to try to put in any referrals for any therapist or even a psychiatrist, if you want to try medication, we can definitely do that. Okay? All right. So thank you so much for coming into my office. I hope you feel a little bit better and have a bit of a better answer. Okay? So I hope you have a whale of a day and a good rest of your night. Thank you. Bye now.